If you had one superpower, what would it be?
I think if we could remain human.
What do you miss the one thing about the physical hospital?
The touch. A touch says a lot to people who are in distress.
Your top priority for the team?
Safety.
We're living in unprecedented times today, nothing that we could have imagined or planned for. Today, I have a special guest who's fighting in the front lines along with his team this battle against the virus. Dr. Ashutosh Raghuvanshi, the CEO and Managing Director of Fortis Healthcare. Welcome to Tete-a-Tech, Ashutosh.
Thank you.
As we look at your business and any business today, working with digital, working with data, is becoming the need of the hour. If you look at doctors, nurses, the clinical support staff, the administration, the management inside your company and hospitals, how are you enabling them?
People are realizing what is the great importance of technology and how we can be more efficient by using all those digital technologies. Currently, we are using Teams for meetings, we are using it for teleconsultations with the patients, and we are also using it for our learning and development needs.
How do you continue to manage culture and empathy in an environment where everybody is in crisis management mode?
The culture of empathy gets translated if the organization demonstrates that. In order to be able to keep the people motivated, it is very important that they have a sense of safety and security. We took various initiatives like increase the insurance coverages. We created patterns of duties which were different from the normal so that people don't find the logistic challenge of traveling, etc. But more than that, I think continuous information flow was very important. In this stressful time, healthcare workers usually step up much more than we expect. They go beyond call of duty, and I think that's something, it is almost like what soldiers do in times of war.
A big thank you from all of us who depend on you in fighting that war. So thank you so much. The healthcare industry and Fortis will transform during this crisis and will change as you emerge out of this crisis. How do you see that change landing? What kind of transformations do you foresee?
Yes. So I think one of the first changes is that we will have to depend a lot more on the technological platforms. I think we did not do enough in past to promote teleconsultations, for instance, and many other things which could move on to the digital platforms, like our reports and our information systems, etc. Infrastructures will change to some extent. The hospital infrastructures, I mean, and that is because the hospitals typically did not have that much of isolation kind of capacity available.
Now, thank you so much, Ashutosh, for all the time that you have had and all the best to your team. As I said earlier, you are the soldiers in the front lines, and we are all really rooting for you. Thank you so much for joining us on Tete-a-Tech today. Stay safe.
Thank you. Pleasure.